Good evening, everybody, and welcome to the Board of Health meeting, Monday, May 2nd, 2022. We do not have any hearings scheduled, so we're going to jump right into our action items. First off, we have invoices to reimburse Heather Doucette for CPR material, reimburse Jean Marie Joyce for mileage, and then we have an invoice from Happy Frog. So I'll entertain a motion to accept the invoices as presented.
Motion.
And that's motion Lisa.
Seconded.
Second Matt. Any discussion? Hearing none. All in favor say aye.
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 Aye, so motion passes. Then we have disposal work permits. I apologize. Disposal work permits, 70 Deer Run Drive, 20 Pheasant Run, 5 Washington Street, 51 Cedar Mill Lane, and 125 Highland Street, which is repairs only. So I'll entertain a motion to accept those disposal work permits as presented.
Motion.
It's motion Lisa,
Seconded.
second Matt. Any discussions? Hearing none. All in favor say aye.
Aye.
Aye, those motions passes. And then we have food service permits. We have Bridgewater Emergency Food Pantry and United Methodist Church.
Rob, the food pantry did not realize they already did have a permit, so we can remove that and just do the United Methodist Church.
Okay, so the East Bridgewater Emergency Food Pantry.
Yeah, they submitted an application when I was on vacation, but
Oh, okay.
when I got back, they were issued a permit in 2022 already. They must have misplaced it, so we'll get them a copy.
Okay, great, thank you. All right, so that just leaves United Methodist Church food permit. I will make a motion that we accept that permit as presented.
Seconded.
Second, Matt. Any discussion? Hearing none. All in favor say aye.
Aye.
Motion passes. We have some installer permits. Losowitz Homes, Ryko Excavating, Fairmont Company LLC, Howard D. Moquin and Sons Excavating. So I'll entertain a motion to accept those permits.
Motion.
Okay,
Second.
motion Matt, second Lisa. Any discussion? Hearing none. All in favor say aye.
Aye.
Aye. That passes unanimously. Okay, and we do need to amend a prior approval for 2026 Plymouth Street. And it's basically how the permit was applied for, or the description of ownership of the septic system was originally submitted, and I'm gonna let Jean Marie help us out and kind of guide us through what the difference between the two are.
Okay, if you look in your package, you have a memo that's dated today. It says septic approval, May 2nd, 2026. This is one of those that I kind of came in on the middle of. Septic plan was originally reviewed by environmental partners, and comments included a letter to the East Bridgewater Conservation, where the septic plan was considered a shared system with specific requirements by the reviewer. The Board of Health accepted the review and comments and approved the plan at the Board of Health meeting on October 5th, 2021. The installer signed out his copy of plans on January 20th, 2022, and the leaching area was soon constructed. I did the inspections on the field. So basically, in getting ready for the completion and to sign off on the certificate of compliance, I reviewed the file and checked out the paperwork. I notified the developer and his attorney that we needed additional paperwork, and we asked for the grant and easement and financial assurance required, and proof that it was registered at the deeds of the registry. The reviewer and the attorney considered it a shared system in that many people were using one leaching area. He was using shared systems as defined just in general use.
Okay.
I went back to Title V. A shared system is a septic system. If you look at my little hand-drawn picture, it kind of gives you the thing. It's different owners own a property and they're using a leaching area that's not on property that they own. So they're actually using a shared leaching area. This is more like, this is a condo association and has an agreement as a condo association and has been put together as a condo association. So it's not considered a shared system like we commonly think of them. So it's covered under Title V. And that financial assurance goes with the condo association. If you do a big shared system, both the local Board of Health and the DEP have to take responsibility of getting the system repaired. That's the biggest difference there. So we are the top, which says it's like a condo association, and this system is run by a condo association.
Can I ask
So
a question real quick before we
that's the
clarify
difference.
some things?
Mhm.
So, when they presented initially to environmental partners, they used the term shared system. The developers use the term shared system.
Yes,
Okay. Shared system is a term in Title V. It has a
yes,
specific meaning.
yep,
And the specific meaning is that more than one independent owners share a leaching field that neither of them own.
right,
Okay. But they did not mean that meaning.
no.
When environmental partners reviewed the plan, did they review the plan under the Title V meaning of shared systems, or under this general term that meant that they were gonna do some sort of,
He took it to mean the shared system as a Title V shared system.
did the plan as shown show that?
No. It shows a common leaching area used by many owners.
Okay,
But the condo association, which is made up of the owners,
Mhm.
owns a leaching area.
okay. But there would have been no way to know that on the plan that they owned the leaching area? And therefore, this wouldn't be a shared system
It
under
showed
Title
it
V?
as one lot.
So there should have been no confusion that this was not a shared system under Title V?
Not to me.
Okay.
But I did ask him for a clarification of who was responsible for the leaching area.
Okay, yep, I just want to make sure that we were clear on this stuff, because we approved this, so I want to make sure we didn't screw this up somehow.
No, I just think it was,
Okay,
I went back to Title V definition, that's all.
okay,
So what I would probably suggest that the board amend their approval of October 5th and approve the plans as submitted, with the condo association taking financial responsibility for the septic, as in the letters of incorporation.
So what we're going to do is going to accept a motion to amend the October 5th approval to reflect the single ownership of the condo association of the leaching field. And that would remove the term shared ownership from the approval process, or from the permit.
Right.
Okay. Does anybody want to add or change,
I
or?
was just gonna say, that. So the way you approved it on October 5th was you approved a contingent upon them supplying the requirements under the shared system. So it was like the funding, the description of ownership.
Right.
And so everything was approved except for those items.
okay.
So it was approved contingent upon those. So you could really just amend it to say, that it is approved without requiring the shared system documents.
Based on
You know,
the
basically,
conversation.
so yeah, you approved everything else except those things had to be
I
submitted prior
vaguely
to
remember,
issuing the
but I
certificate of
think-
compliance.
I don't know if they actually had a condo association back.
They hadn't even built the buildings.
Well, I mean, you
It's
could,
like
yeah.
pre,
Yeah,
Yeah, I
Yeah.
mean, they have condo docs for the planning board, and even like Scott and EP said, we don't have anything to compare it to really
Right.
here. We don't have another industrial condo association like that. It doesn't, but the Title V doesn't differentiate between industrial and residential.
so, is there anything else they need to do to meet the condo requirements? As they are, as planned and as built? Are they missing anything for that?
You just have to
No,
record their
'cause
condo docs, right?
Right,
Record their
and it has
master
been.
deed.
So,
Yeah, because planning wouldn't release the lot until it was.
and I would assume so that the condo association will usurp any common area maintenance and whatnot and unless they dissolve their condo association, but that would have to come before the board if and when that ever.
Well, for example, we have a 40B in East Bridgewater on Washington Street. That was a condo association, and at some point, they just, as a group, decided to stop paying into condo fees. So when the systems fail, that's really, now they have to come up with how they're gonna pay for it. But if it was a shared system, I believe we would have to put it out to bid. Am I correct, Jean Marie?
Yes,
It'd have to be a
we would have to
retainer or
review
something.
it, yeah.
Yeah.
Yeah, so I think that they've got a budget written out for how much is gonna be for stormwater, how much is gonna be for septic, that they're gonna be all paying in to their condo association
That's,
fees.
so, but when the condo association dissolves and the septic fails,
We can order them to fix it.
we can order who to fix it.
Each
All of the
individual, yeah, all of them.
Yeah.
Okay, so there is
Yeah. There is a mechanism.
individually, there's a mechanism to make sure that it gets repaired.
Right.
And I'm looking at it going, no one owns it, there's no condo association, it's ownerless now. How do you force someone to pay for something they don't own?
Yeah. Well,
Okay, but as long as there's a mechanism to take care of.
that's a good
things.
question. I don't know.
Yeah, you do order each individual
Yeah.
to do it.
Okay. So, what's the plan then, just remove
So-
the qualifications?
I'm sorry?
Is the plan just to remove the qualifications we passed under, and then they're fine?
Right.
So, to amend the October 5th approval to reflect now a single ownership of the homeowners association versus a shared ownership under the permit application.
If that motion works, I will make that motion.
Okay.
I will second.
Okay, so motion Matt, second Lisa. Any further discussion? Hearing none, all in favor, say aye.
Aye.
Aye. So that amendment passes unanimously. We have a couple of discussion points. The first is the Beaver or Crescent Street update.
I forwarded you guys all the email, I think, from Rob Ken and Mike Calacan showed that they were out there, so I was just wanted to make sure you were aware that they had been out there.
Oh, I drove by yesterday, it's really high on the other side now, but there is no water on the inside. It's gone.
I mean, the beavers are still gonna be there.
Oh, yeah,
you
they're
know,
gonna
there's
be
water
there.
still gonna be there,
Right.
but they did what they said they were
Looking.
gonna do, and they're gonna be monitoring it.
So them being migratory, are they back?
Oh, they're back.
They're back.
All right,
Yeah, that was the problem on Crescent Street.
gotcha.
I don't think they leave, don't they hibernate?
Depends on how deep the water is and how much of it freezes. I know that sounded weird, but if it's frozen, they leave.
Health agent updates, Jean Marie?
You guys have your little sheet in front of you. We did site assessments, last 3 weeks. 5 Washington Street, 20 Pleasant Run, recess for repairs, and groundwater level has dropped to seasonal. The repairs, I approved them all because they were all repaired without variances. So I approved them as agreed with you folks. New construction, 125 Highland Street, they're only gonna repair the tank, the grease trap, and the pump chamber. They're leaving the leaching as is. The reason for that is if they repaired the leaching, they then triggered another threshold with stormwater management, and it made another filing and that whole thing. So they're just gonna leave it for now. 406 North Central Street has been halted until the applicant has applied and been approved by Conservation for work in the 200-foot riverfront zone. Ashland Dairy was inspected and opened for the season. Follow-up inspection was done with them. Flashback Frank's has been inspected. Subway was routinely inspected. Oatmeal Tacking and Amante Deli was inspected. I didn't get into DeAndre Foods because they close at 3, but I noticed they have a porta potty on the right-hand side, and I gotta find out why. Which probably shouldn't, not something we always like to see.
And can I just, yeah, quick question, I don't mean to interrupt your flow here, but
Go ahead.
I was driving by the, you know what, I'll bring it up, I guess maybe the reason, I shouldn't say the reason behind that one, but is a business allowed to have a temporary,
Not without Board of Health approval.
okay,
They offer like a one-day thing, but if it goes beyond 30 days, which this has,
uh-huh,
we need to know why.
okay. Okay, that answers my
Okay.
question, all right.
They shouldn't be using it to augment their in-service one in the ground. Okay. Voluntary housing inspection at 23 West Street. And then I just did an inspection today at 558 West Street. It's gonna need some follow-up. Dunkin' Donuts Serve Safe certificates were received for 5 people, so they've met their goal of having at least 2 per store. So they're now in compliance. COVID Omnicheck is ticking up and expected to peak this week. You're not gonna see this in our Maven reports because people are doing their own at-home testing, and that is not being reported to the local Board of Health, which is fine with us. Okay? The expiration dates for our eye health at home test have been extended by 3 months, and they probably will be extended out 9 months by the time we get through. The company's just doing it every 3 months instead of total expansion. So that's where we're at. Any questions?
How many do we still have in the office, of those kits?
I have 1 box, but I'm sure that they have
In the town, we have
quite a few.
I have
thousands and thousands and
thousands.
At
thousands.
least 2 boxes still at the fire station.
Yeah.
Where did we get the data for the Omicron tick-up?
It's coming through the wastewater for Massachusetts and also the amount of people that they're seeing through the hospitals.
I was just curious, because I know the CDC isn't tracking it anymore, so I don't know where they would get the
It's mostly
numbers from.
indirect, it's not, we're getting more through the Maven thing, so. By that I mean like 10 a day instead of hundreds, but that's just because people are using the at-home kits.
Mm.
Flu's up, tick-borne diseases are up, it's spring.
Everyone's outside.
So I do have one more thing, Rob, that just came up today, actually. And Jean Marie wasn't really sure where you wanted to go with it.
Hold that one.
Things like, is it the Multicultural Family Day that they have up here and Chili Chowder Fest? So we have food vendors that aren't food trucks. They're like, they have like a kitchen, say in Brockton. If I have one that's a barbecue kitchen in Brockton. They prepare all the food there. They bring it here to sell it at the Multicultural Day. Same thing like Chili Chowder Fest. They prepare the chili somewhere and bring it. And in the past, the board required, so for instance, Chili Chowder Fest, you had to prove that you had a permit for where you were preparing that chili to serve it. But we did not require them to get a permit here for the day also. So I had a call today about, this new event, and we now have a new health agent, so I ran it by her, and, she was kind of leaning toward, they need to get a permit from here too, because they have to keep it warm and serve it. We don't do one-day permits right now. We do $50 seasonal permits, and then we do annual permits. So I don't, I want to make sure before all these events come up, because I think there's commercial clubs having like a summer fest, and a lot of those are food trucks, so that's kind of a non-issue because the food trucks get their permit anyway, but things like the Chili Chowder Fest or this place where they're preparing food, so, this person has a licensed kitchen, is inspected in Brockton, it's going to prepare the food there and bring it here to bring to the event.
So when's the first date of,
It's coming up in June.
okay.
That's why I didn't want to put it off too long, so,
Right.
to discuss.
Is it a charitable event?
It's nonprofit.
Yeah, and I do believe nonprofits have some exemptions, Jean Marie, is that, am I correct in that?
Doing the right things.
Nonprofits do have exemptions, but they're not exempt from notifying us what they serve. So the way this federal food code says, you need a permit to serve food, not to sell, not to. So some of our trucks, they prepare the food at a commissary or at a kitchen, like at a restaurant or whatever. Then they put it on their truck and they heat it up and keep it hot all day. How is that different from this person who's preparing it at their place and bringing it and keeping it hot at their little tent all day?
Well, I don't think there's technically a difference. I think it's more so that they may only do it this one date as opposed to doing it for a season. So I don't know if we implement a one-day permit or if we implement something where the runner, the nonprofit organization, can get a permit and assume responsibility for whoever's procuring food at their events.
So I think last year what we did was everyone that wanted to attend emailed us a copy of their existing food service permit so that we could see they actually are a food service person.
Yeah.
But we didn't go over and inspect the event because, it's on a Saturday or Sunday or whatever it's on. But we did, require them to submit paperwork to show that they had a license, similar to Chili Chowder Fest.
Yeah.
So basically what's important for us is we know what they served. So that if someone says, I got sick off the soup, you know who had the soup, and you know
Yeah,
how to get in
agreed.
touch. That's the important part of it.
Okay.
Not my end of it, or whether we get money for it, but just we have that kind of contact. Like if a caterer comes into town and serves food, we usually require them, if they went to the church would have to keep a log of who was in there and what they served. Just so that if something did happen, you knew how to get in touch with the person that prepared it. And that, I think, is the key piece. You want to know how to get in touch with the person who prepared it. So I think you're right, as long as they give us the permit for the kitchen and say what they're serving.
But is it
we're covered.
strictly food vendors? It's not like a potluck like that you would have?
No, it's
No,
their,
it's
so
actual
they've reached out, so they're trying to, they're trying to make it multicultural. So like last year, they were reaching out to different
Yeah.
ethnicities and bringing in their food. So there wasn't like, you weren't finding a lot of burgers and dogs and stuff, you were finding, they were trying to reach out to people.
I was just thinking it's
No.
not gonna be like, so-and-so's coming and they're bringing a big giant thing of rice.
No.
You know
No,
what I
it
mean?
shouldn't be
It's more
that way.
just
No.
restaurant, yeah.
Yeah, no, it's actual, the woman that runs it, and I can't think of her name right now, but
Nadia?
Nadia.
yeah, she did reach out last year, and she had all of her food people contact the Board of Health first to see
Yeah, right, I would
what we
think if
needed
they
from
give, if
them.
they supply us with a list of who's providing food and they.
in their
give us a
copies of
copy
their permit.
Permits, then they should be
Then
covered.
We're covered, yeah.
Do we have anything that prevents them from having we're having a one-day thing every weekend and we're,
Well, they have to get a permit from the selectmen
okay.
to do that event permit, so
But-
we get through that they circle that
That
through all of
covers-
us.
Yeah, I'm not concerned about Nadia.
Yeah,
and the,
right.
Anybody
I'm
that-
more the food service guys going, well, I didn't have to pay for a permit to serve, so I can have a one-day event here in town every day if I want, and
Yeah.
never get a permit from the town. We don't have really a way to circumvent that, short of requiring them to get some.
Well, I
sort
don't
of
think
permit.
they're more of a food truck, isn't it more like catering? Like
Yeah, they're not
More of a
going, yeah,
caterer,
yeah.
yeah. Yeah, they don't have a mobile operation per
Okay.
se.
Cool.
So I say,
I
yes,
agree with
let's just
Lisa.
get the list and copy the permits.
That works.
I concur. Do you concur?
All right, so, anything else?
Nope.
Okay. Before we close, a couple of dates coming up that we need to keep on our calendar. Tomorrow night at 7 p.m., there's an information forum for the sewer connection proposal on Route 18. That's going to be at the high school. That's tomorrow night at 7 p.m. And then we also have election on May 14th. So please, register, vote early, or vote in person. That's May 14th. And then again, before we close, I'd like to recognize Matt. This is Matt's last meeting. And Matt, thank you very much for everything that you've done, everything that you've helped all of us and stepped in as vice chair and ran a couple of meetings and.
We only ran one meeting.
Well, okay, well, whatever the case may be, but seems like more, but again, I appreciate everything that you've done.
It's all the voters' fault.
Wish you the very best and hope that you come back in the realm of public service or elected public service. I know, and outside,
Public service.
I know that you're out there.
I've dedicated my life to public service.
You have, but being an elected official is also it's
It pays less.
it pays right,
Yes,
pays less than the
it pays less.
than
So
overall
rewarding.
volunteer public service. But thank you very much for everything you've done to help us and the board and also the town of East Bridgewater, everything that you've done.
Thank
So best of luck and thank you again.
Matt, I just want to say that you filled Bill Hubert's seat, who I worked with for, 15 years. And I think you did him proud. I think he would be very happy to work with you, so thank you for stepping up when
Okay.
I really needed you. So, thank you.
Thank you, guys. It's been an awesome time. I'm glad I did it. And maybe it'll come again sometime. But right now it's baseball
I hope so.
season.
That's
I've got a
fine.
lot going on.
Play ball.
All right.
There's things to do.
So I was given strict instructions at 5:30, wrap it up. Hopefully that we're close enough to 5:30. So I'll entertain a motion to adjourn.
Motion?
Motion Lisa, is second Matt. Any discussions? Hearing none. All in favor say aye.
Aye.
Aye. And that concludes our meeting. Board of Health, Monday, May 2nd, 2022. Thank you, everybody.
So